You have been doing the work, the therapy, the somatic practices, the self-care, and yet your body will not come online. It is stuck in the hibernation of the chronic freeze. Welcome to this episode of the Biology of Trauma Podcast. I'm your host, Dr. Aimie. Here's why I wanted you to have this conversation. Whether stored trauma contributed to your thyroid issues or not, it is now a biology piece that is holding you back. It decides how much energy every other system in your body is allowed to have, including your nervous system. In this episode, we're going to get practical. We're going to cover selenium supplement for thyroid optimization, whether you have gut and thyroid issues, which one should come first, and how do you know if it's adrenal fatigue or thyroid. Now, this is part 2 with Dr. Amie Hornaman, known as the Thyroid Fixer. In this episode, we cover the important repair tools of a biology trauma as it relates to the thyroid. Still not sure if you have a stress-related condition or if it is an expression of unresolved stored trauma? Then I have a guide for you in this episode, along with the link to part 1 if you missed it. Let's get started. One thing that you mentioned, and I'd like to circle back to, is selenium. I have come to fall in love with selenium. And so I want to circle back to, why should this nutrient, vitamin, be on a person's radar as they are looking to support their thyroid?
Oh yeah, selenium. I really like the form selenium-methionine, and selenium comes in and really helps love on and support. It's almost like, if somebody was holding you up, selenium is just there, like holding the thyroid going, it's going to be okay. I'm going to help you out here. Like we're in this together. And it's helping that T4 thyroid hormone convert over to T3. So it's one of, I use the term no duh. I'm totally dating myself back to the 80s. I know you probably all know how old I am right now. But, I call them the no-duh supplements. Like, of course, duh, we're going to take these every day. So that's selenium, magnesium, vitamin D, iodine. Like, those are your B complex. Like, those are your core baseline foundational supplements to support your thyroid gland and many other systems as well.
Now, many people who are recovering from the impact of trauma have digestive issues. Imbalances in their microbiome, leaky gut, maybe even SIBO or candida overgrowth, all this. Maybe they are constipated, all the stuff. Give us a headline of what is that connection between gut imbalances and its effect on the thyroid for shifting how it does its job.
Yep, absolutely. So we in that T4 to T3 conversion process, it happens in a couple of different locations. It happens in your liver, in your gut, and then in your thyroid and peripheral tissues as well. So if that T4 to T3 conversion happens in your gut, and we really don't know the percentage, I've heard a bunch of different percentages. I don't think there's a way to actually test that. How can we actually test your gut microbiome and say, oh yeah, there's 70% conversion happens in the gut? We don't know. We just know that that's a conversion location. So obviously, if the gut is inflamed, if there's SIBO, H. pylori, anything like that, dysbiosis, that's going to affect that T4 to T3 conversion. I mean, you're not going to get a smooth conversion, at least in the gut location. So obviously, we want to support the gut as much as possible. Now, I will throw this in as well. A lot of times, people hear or they get the message, and this kind of goes back to what I said in the beginning. There's a lot of information being thrown at you, so I want to disseminate it so you can understand it. People will get the message that all you have to do is heal your gut, and that will resolve all of your thyroid problems. And it's like, but the thyroid, again, is the master gland and controls gut motility. So we'll get bloated, we'll get constipated, and sometimes we'll even be set up for something like SIBO, small intestinal bacterial overgrowth, because our thyroid is low and slow. We can't detox properly if our thyroid is low and slow. So sometimes we actually have to be treating the low thyroid function up top to get more motion going, to get more motility going through the gut so that we can process, digest, detox, assimilate, not let food just sit there and ferment. And at the same time, be addressing anything that we're seeing in our gut as well, to balance that microbiome. So it's kind of that's a situation where you have to step back and go, okay, let's not, again, just do a gut healing protocol and think that that's going to have a reverse effect on the thyroid. It's going to help with the conversion, but we might have to treat both systems at the same time.
Very similar to the principle of stress and trauma. You can't neglect stress and trauma in your life and just try to fix your thyroid, or just try to fix your thyroid and not deal with the stress and trauma. They are now feeding each other. Speaking of which, let's talk about the adrenal gland. I feel like that is another source of a lot of misinformation. And so with the adrenal gland, what often is said is that the adrenal gland, it makes cortisol. Cortisol is really what drives so much of the thyroid. And I think that you have a different no-nonsense view of cortisol and thyroid. So show us kind of how you see the adrenal gland and the thyroid gland and their interaction.
Yes. So I think the term adrenal fatigue gets thrown around way too much. And I think adrenal problems are overhyped. And I know there's going to be somebody out there that goes, well, no. I tested my adrenals. I did a 4-point saliva cortisol panel, and I had this one marker where it was high. Yeah, you might have one marker where it's off a little bit. But when we're talking true adrenal fatigue, adrenal exhaustion, you'll see this flat line low. Like cortisol output will be totally bottomed out. That is so rare. I mean, you'll have to jump in too, Dr. Aimie, and tell me, like, do you also agree that you don't see that flatlined high or flatlined low? You don't see that pattern very often. But yet people will be like, oh yeah, I got adrenal fatigue. I go, do you? They go, yeah, I tested my one marker. My doctor tested my blood, my cortisol, and it was low. I'm like, that's one marker in the morning that does not tell us anything about your adrenal output through the whole day. You have to do that 4-point saliva panel so that we can see what's it doing through the day, because it should start, moderate, high, moderate in the morning, and then kind of gradually drop down through the day and be lower at night. Do you know that pattern? Well, no, I just know the morning. I know that that's low, so I have adrenal fatigue. I'm like, no, you don't. That term is thrown around way too much. So I want to start there, and then I can go into kind of like the other stuff with adrenals and how adrenals and thyroid play in the same sandbox. But I want to throw it back to you, Dr. Aimie. Do you see that term thrown out a lot?
It is, and it's also one that frustrates me because we're missing the mark in the way that I understand the body's stress response. Cortisol is part of that. I'm going to give you energy to help you be alert. And yet, if it's not safe to be alert, if it's safer to be hibernating right now, well, then of course the body's going to be like, no, we actually don't need to prioritize cortisol. We actually don't want cortisol right now. Or we can have nutrient deficiencies, just like in the thyroid. If you don't have the iodine and the tyrosine to make thyroid hormone, guess what's going to be low? Would you call that thyroid fatigue? No, I think you would just call that deficiency in tyrosine and iodine. And same thing with the adrenal glands. The adrenal glands don't decide by themselves, all right, I'm tired, I'm going to stop making cortisol. There is a reason that it is responding to either I don't have what it takes to make what you're asking me to make, or it doesn't make sense to make this based on what's going on in our life and in our body. So yes, that's you.
Yes. Beautiful. I love that. I absolutely love that. And you are correct. I think we demonize cortisol too much too. The body will call on it when it's needed. It's actually needed for life. So all of these people taking adrenal supplements that just push down cortisol, we need to stop demonizing it, because it's a needed hormone. It's vital. And to your point too, Dr. Aimie, is it's not just, okay, what can we do to sprinkle adrenal fairy dust on ourselves and heal the adrenals? It's not about that. It's about addressing the trauma. It's about addressing the systems that might be off, and not just hyper focusing on this gland, the adrenals, that get a lot of social media hype, a lot of social media hype. And, a lot of times too, we have to look at when we're listening to messages on Instagram, if a 90-second reel isn't telling the whole story. So you might see someone come on there and go, do you want to address all of your trauma? Well, that starts in the adrenal glands. So all you got to do is take my adrenal supplement and it's going to heal everything. And, you want healing quickly. We all do. I don't care who you are or what you're dealing with. You want healing yesterday. And it's just not that way. It just isn't. So this little adrenal supplement that the IG influencer is pushing on a reel is not the be all end all. And it's not going to be the answer to all of your issues. I think this is really where knowing your systems and the education that you're getting in here is key, because it's going to help you understand how your body works. Now, the adrenals and the thyroid like I said, they play in the same sandbox, meaning if someone has gone through massive trauma, and I realize that some people in this group, you might be right there, and I feel for you. And it's literally affecting your cortisol output to where we do see like, oh man, this person they're just not putting out enough cortisol at all to even give them a response. And like you said, maybe they don't need it right now. And then maybe sometimes they do, and we're not getting it. So this is where we can add in T3 to come in and actually love on the adrenals. There's a thyroid author, Paul Robinson. He writes the circadian T3 rhythm method. And I've used it in some of my patients that legitimately do have like bottomed out cortisol, to where we can strategically use T3 to just get that little bit of a push where we need it. This person needs a little bit more of awakening response. They're waking up in the morning and they can't even open their eyeballs, even though they just slept for 8 hours. So let's give some T3 to bump that up. And then cortisol works with T3 and T3 works with cortisol. So we can use that strategically based on what we see in that individual, but kind of coming back to the universal statement of we can't just always blame the adrenals or think that we need an adrenal protocol or supplement or whatever to heal our whole body. It's not as simple as that.
It is not as simple as that. And I think of as a person has been working hard on their healing journey for some time, and things are moving in the right direction. And now they are looking to optimize, no longer just survive. They're through that part. Now they're looking to, wow, if I can feel this good, how much better could I feel? What are safe things to do and experiment with the thyroid to see how better you could feel?
Ooh, that's a great question. So I think, first of all, the supportive nutrients, right? Just get those in the mix, get those foundational nutrients, minerals on board, because that's already going to start shifting the system. I know iodine is hugely controversial. I can certainly go into it if you'd like, but iodine is just, it's just beautiful. When we give, even when we're starting with patients and we know, okay, we're bringing in the right thyroid hormone, we're bringing in the sex hormones, those take a while to build in the system. And, again, like I just said, our patients want results yesterday too. So we start them on iodine, and really within a couple of weeks, they're like, oh my gosh, I know I don't have my T3 and my hormones in yet, and I get that, but man, am I feeling better. It's like this fog is lifted, and like, I'm thinking better and I'm feeling better, and this is fantastic. And that's what they'll notice immediately with iodine. So something is in the right amount. We don't overdose iodine. We use it in the right amount. But those foundational nutrients are key. And then from there, or maybe, at the same time that you're adding in those foundational nutrients, you're going, well, I heard Dr. Aimie talking about testing. Well, I don't get that full thyroid panel that they were talking about. And then you get the panel and you test, don't guess. Because data is knowledge and it's power. And when okay, these are my numbers and here's where I have to be. And I do have in the book, the optimal ranges in there that we talked about, how I want you in this bullet, in this, bullseye area. We do have those in there. So you get your tests and then you go, oh, well, now I can see My free T3, that's low. Yeah, it's in the normal range, but it's low normal. So there's some subclinical hypothyroidism going on here. And oh, look, I do have antibodies. I never looked at the TPO and the TGA antibodies. Hey, turns out I have Hashimoto's. Okay, well, there's more knowledge right there for you about what's going on in your body. So yeah, I think it's both. You could support with the foundation, and then you want to test and not guess.
Yeah. And I want to come back to this idea that everything that we're talking about here directly affects a person's stress resilience.
Yep.
And so when they see themselves needing to respond to something, there's a problem that needs to be dealt with, and they find themselves being like, oh, I just don't have it in me. That would be the moment that I would want them to think of thyroid. I'm going to go test those labs and see if my thyroid is part of the equation for my body saying we don't have what it takes to respond to the stress in our life. Because at the end of the day, stress is not going to go away. True. Life is stress. That's part of life. Just like grief is part of life. You can't live on earth and not lose something, somebody that's important to you. That's part of life. So rather than trying to avoid life, we are becoming the kinds of people who are building our inner resilience to ride those waves of life. And the thyroid is what helps you get up on your board and ride that wave of life. So when you're feeling like, I just don't have it, I want you to be thinking, what can I look at in my biology that is affecting my capacity for generating a good stress response when I need it?
Yep, exactly.
And
I hear that all the time.
Yeah, as people start to do this, I've heard you say that starting to take iodine can already help people feel better, starting to take some of the nutrients. On average, as people start to apply the different support to their thyroid, when can people expect to start to see a difference in their stress resilience?
That's an easy, I get this question all the time about, kind of the timeline of change once we start addressing thyroid function. Although you have to throw out, you are an N equals 1, you're a unique individual, your response is going to differ, but in general, really 30 to 60 days is where we see that. That's one of the first shifts. Energy and stress resilience and brain function and mood are the first things to shift in the body when we start getting you optimized. Then comes like the weight. The hair is more like 6 months to a year. Weight coming off or the stopping of the weight gain. This is very, very common with thyroid as well. That's usually between like month 2 and 6, but month 1 to 3, month 1 to 2, that's where the lights get turned on and we really start seeing shifts in energy and mood and stress resilience.
And that gives me a lot of hope because we're not stuck with our current resilience. We're not stuck with saying, well, I guess this is just part of getting older. Like there is so much that we can do when we understand the biology behind it. Aimie, as we wrap up, what final words and message would you want to share with the world?
What I always give and what you just kind of like springboarded off on, hope. You have to have hope. So here's the thing. My story, if you do have thyroid issues, I was in your shoes. Many, many years ago, I was misdiagnosed 6 different times. I know that frustration of going from doctor to doctor to doctor, getting the same answer or getting a Band-Aid medication. I was handed antidepressants. I was handed sleeping pills. I was in my 20s. I was not tested properly. I was dismissed. I was pushed aside. I was told I was normal. I was told to eat less and exercise more. I was told I'm just getting older. I was in my 20s. If I would have lost hope, which I could have very easily done, I mean, after 4 MDs or DOs stand in front of me and tell me that I am normal and nothing is wrong, why wouldn't I believe that and just stop there? But I listened to my gut and I listened to my intuition, and I will say this till the day I die. You know your body more than anyone with a white coat. You know your body. You know when something is off. You know when it's not right. You keep going. You have hope. You don't stop until someone gives you an answer and a treatment plan that works. I mean, I got an answer from doctor number 7, but I didn't get the treatment plan that worked. But at least I got the answer. Then I pursued functional medicine, got the treatment plan that worked. So it all kind of comes together. But you have to have hope to keep going. You don't give up. You don't give up.
Yeah. And invest in yourself in a way that you believe that you deserve it.
Absolutely.
That you're worth it.
You know, because we only have so much time on this earth, right? We only have so much time. We got to enjoy life the best we can.
Don't let your inner programming of like, no, I'm not worth it, stop you. This is where you do your trauma work alongside finding the answers that work for your body, that work for your life.
Yeah.
They go hand in hand. So
yeah.
Thank you. Exactly. Thank you. Thank you so much for your time, Dr. Aimie. Appreciate you coming on. As Dr. Hornaman said, you know your body. And my guess is that you know your body is holding trauma, not just stress. And that is what my new guide, Stress or Trauma, walks you through. The link is in the show notes. And some of you actually may be realizing, I don't know my body. And this is the reason why I start everyone with pre-work before we jump into the deep work, because you need to know how to know your body. And that is what happens in the foundational journey. We lay the skills, the foundational skills, to get to know, to feel, to track, and to shift your body and its states. Her book is The Thyroid Fix. Highly recommend that you grab that. I'll have the links in the description in the show notes, along with the link to part 1 of this conversation on thyroid and the biology of trauma. I'm Dr. Aimie. Until next episode, lots of love.